Hi, I'm Ian Reinge from Reinge Education.
And I'm Daniel Lawrence from Rocktape UK.
And in this video, we're taking a look at anterior cruciate ligament injuries and what taping can do to help with this.
We'll be showing you a taping application and discussing why you would use it to help with your rehabilitation of ACL injuries.
For more information on ACL injuries, we have a bite-sized CPD video available. You can go to www.reingeeducation.co.uk, subscribe to our YouTube channel, and of course follow the links below.
For more information on Rocktape products and education, please visit rocktape.co.uk. Okay, so before we look at the ACL taping application, we're just going to put things in context here and ask our model to perform a few actions that will just help us to highlight a point. So starting with a shallow lunge movement, the ACL has been described as like a seatbelt mechanism that when a movement is performed quickly, like this lunge movement here, it can help to stabilize the knee with this particular motion. And importantly, at lower levels of stress, it provides important proprioceptive feedback to the brain as to the knee's position, therefore helping to stabilize the knee via the surrounding musculature. So if an ACL is damaged, it's not just a structural damage, it's also a sensory damage because we've lost some of that sensory input. And there's the lunge movement, but also the step down movement here, which is of course very common with day-to-day function of simply walking down steps. So what we're going to do with the tape is try and compensate for that loss of internal sensory information, that interoception. We're going to try and compensate for that by adding more exteroception, therefore by adding more external sensation input through the skin via the tape during this step down or lunge type motion. So when these motions are performed, the tape will almost provide a kind of sensory catching to the knee, providing the brain with more information on the knee's position and giving it the opportunity then to stabilize the knee using its own musculature. It works really well, it's comfortable, and it certainly sits nicely in with a strengthening rehabilitation package. And I find clinically helps to improve patient confidence in movement, which really does help just to get on with the rehab in practice. So let's do it.
Okay, so hey, you've got your tape prepared already, which is nice. You've cut the corners off as we do.
Ready to go.
To stop it catching. So yeah, let's have a look at this technique. There's a little question I want to ask you about it in a minute, but let's tape first.
All right, so I've cut two strips of tape of decent length that can run from the anterior knee. Again, we'll use that tibial tuberosity there as a clear anatomical reference point. The tape runs down the sides of the thigh, so down the lateral thigh there, and then we're also going to go down the medial thigh here as well.
And I'll throw a question at you there while you're putting it on. Why are we choosing that instead of that wrap around the knee?
Good point. Right, so the reason we're choosing the tape to run laterally and medially rather than around the knee is a small point, a small kind of nuance to the taping, if you will, that differentiates it from the wrap technique. And I will explain that in just a second as I get this into the right place. Okay, so from here, the tape can then be, sorry Richard, pulled a few hairs off there. Have the knee a little bit straighter. Okay, you want the knee at about 30 to 40 degrees. And then each side, pull the tape. You can do one side at a time if you like, but if you do both sides at the same time, you're going to have an equal amount of strain laterally and medially. Stick the tape down, and then you've got decent anchor points with paper off tension, and then finally no stretch at the end. All right, so the tape there is coming medial, laterally, in quite a linear sense, really. Rather than the other technique that we've done in one of the other videos, which was the wraparound technique, is because this is designed to provide sensory feedback during a specific range of motion, and that specific range of motion is early flexion of the knee. It's flexion from straight towards about 30 to 40 degrees when the ACL is thought to be most involved in knee stability, both mechanically and proprioceptively as well. So that's why we're coming around here. As Richard does a step down or drops into the early lunge position, the tape can provide the extra sensory feedback and therefore provide a stimulus to improve motor output, therefore for his brain to basically engage the musculature around the knee and stabilize the knee. And with enough repetition and sensible rehabilitation, we can then create some progressive, longer lasting effects to enhance knee stability and, more importantly, movement confidence.
Yeah, so this actually strikes me as this is neurological taping now. almost, which is quite a different use that I've seen for Rocktape. This is the kind of thing that we used to do with the static tape for exactly the same reasons, playing a bit of a trick on the nervous system, pulling the skin taut early to make the brain think that a joint is in a certain position. But this strikes me as an awful lot better than static tape because it's mobile.
Yeah, absolutely. I mean, it's definitely a neurological, a proprioceptive type of application, which a lot of taping research and theory and techniques now are moving towards and talking much more about that neurological influence. Yeah. And it's, you know, the rigid tapes, they worked, they would do somewhat the same things, but they weren't as polite. They weren't as comfortable.
No.
And
no,
they were not as
weren't.
kind to the skin, and they didn't last as long. So
yeah.
They didn't really serve their purpose in the way that they were designed, even though you could achieve some similar things. This taping lasts longer,
yes.
It's breathable, it's waterproof, it's flexible, so it's much more patient friendly.
Yeah, and I guess it's quite hypoallergenic as well, isn't it? Because the old tapes were zinc oxide backed, and quite a lot of people can react to that.
Yeah, right. It's a hypoallergenic tape, so there's a much lower chance of skin reactions.
Yeah. So again, I think this would be a really useful technique, particularly for trainers, because once somebody comes in with that injury or post-surgery, yes, they'll be having some kind of therapy support, but also you don't need to be afraid to train them, provided you're going with the principles that we suggest in the bite-sized CPD video. But this is a really great way of augmenting it and helping the ACL to get a bit of extra support. Brilliant, thank you very much for that one. Okay, so now that's on, I guess it'd be good to see that action actually occurring again with the lunges and the step downs we saw.
Yeah, absolutely, so we'll do that.
Okay, here's your reflective learning task for ACL injuries. This one is specifically for trainers out there. You have a client who is in the recovery stages of ACL. The therapist who's treating them said they are quite happy for them to start exercising. As with many things, there are some very specific bits of exercise equipment in most gyms that would be ideal for ACL rehabilitation. Have a think about what they are, but in particular, think through the mechanics of what you're doing. Why would a particular piece of equipment be helpful? I'm not going to tell you what it is. Part of the idea is you go and work that out.
And my question for therapists is, when you're encouraging rehabilitation, how can you challenge the neuromuscular system beyond just basic strengthening exercises?